Welcome and thank you for choosing the Mission PT Coagulation Monitoring System. This system is intended for self-testing and professional use for the monitoring of oral anticoagulant therapy by quantitative prothrombin time testing. The Mission PT Coagulation Monitoring System includes one PT meter, one user's manual, one quick reference guide, 5 PT test strips, one strip insert, 5 safety lancets, one code chip, one carrying case, one warranty card, one AC power adapter, one plug, 4 AA batteries, one plastic clamp control solution. Installing the battery. To start the setup process, you will first need to install the batteries. Turn over the meter to locate the battery cover. Press the battery cover tab down and lift the cover to open it. Insert 4 AA batteries into the battery compartment. Note the direction of battery. Close the battery cover and make sure it snaps shut. Coding the meter. Each time a new box of test strips is used, the new code chip included in the box must be inserted into the meter. Compare the code number on the code chip with the code number printed on the test strip foil pouch. It is important to do so because results may be inaccurate if the two numbers are not identical. Before turning the meter on, insert the correct code chip into the code chip slot on the right side of the meter. Press the power button to turn the meter on. The setup menu will be displayed after the Power On Diagnostics test screen. The code number will be highlighted when the meter is turned on. Press OK to view the current code number from the code chip. The code chip number is also briefly displayed when a test strip is inserted after the meter is turned on. If there is no code chip in the meter when a test strip is inserted, or there is a code chip error, the following screen will be shown. Meter setup before testing. To begin initial setup, press Next twice, then press OK to select Contrast to adjust the display contrast and show the following screen. Press up or down to increase or decrease the display contrast. Press OK to save the setting and exit to the previous menu selection screen. To change the date format, press Next, then press OK to select Date. The first screen shows the date format selections. Press down to remove the selection box to the desired format, then press OK to save the chosen format. If the date format selection is month, day, year, the first number highlighted will represent the month. Press up or down to increase or decrease the current setting until the correct month is shown. Press OK to move the highlight to the day. Press up or down to increase or decrease the setting until the correct day is shown. Press OK to move the highlight to the year. Press up or down to increase or decrease the setting until the correct year is shown. Press OK to accept the new date and exit to the previous menu selection screen. To choose the time format, press Next, then press OK to select Time. Press Next to move the selection box between the 12-hour and 24-hour format. You may press Exit at any time to exit the screen and return to the previous menu selection screen without making any time changes. When the correct time format is shown, press OK to select the chosen format. If 12-hour format is chosen, the screen will allow the selection of AM or PM. Press Next to move the selection box between AM and PM. Press OK to select the correct time of day. The current hour setting will be highlighted. Press up or down to increase or decrease the hour setting until the correct hour is shown. Press OK to select the correct hour. The current minutes setting will be highlighted. Press up or down to increase or decrease the minutes setting until the correct minutes are shown. Press OK to store the new time settings and exit to the previous menu selection screen. Press Next to move the selection box to the audio setting. The audio menu selection will show the correct state of the audio setting, which is either audio on or audio off. To change this setting, press OK to select audio, then press Next to move the selection box between the audio on and audio off setting. You may press Exit to exit this submenu with no changes. When the desired setting is selected, press OK to store the sound setting and return to the previous menu selection screen. Select Meter Info to display the meter information screen. This screen shows the meter serial number and the installed software version number. Press Exit to return to the previous menu selection screen. The current selection for display language will be displayed as the next selection screen, either in English or as a landscape picture representing icons shown on the screen. To change this setting, press OK with the item selected. Then press Next to move the selection box to either English or the landscape picture selection for icons. When the desired setting is selected, press OK to store the new setting and return to the previous menu selection screen. Press Exit to exit this submenu without making any changes. INR is the normal default setting for the results displayed. If the corresponding prothrombin time is also of interest, PT can be displayed as well. From the selection menu, the current data display with either INR or INR and PT format will be seen in the selection sequence. To change this setting, press OK to select the data display. The current selection will be shown with a box around it. Press Next to move the selection box until the desired setting is selected. Press OK to store the new setting and exit to the previous menu selection screen. Press Exit to exit this submenu without making any changes. Testing. Fingertip testing for professional and self-testing use. In this section, we will show the testing procedure in a professional environment. Make sure the code chip is inserted into the code chip slot before turning the meter on for testing. Compare the code number on the code chip with the code number printed on the test strip pouch and ensure the two numbers are identical to avoid inaccurate results. Tear open the pouch and remove the test strip. Open the optics cover and ensure the strip holder is installed properly as shown. Insert the test strip into the optical test area under the strip holder. The meter will automatically turn on and beep if the sound is enabled. Observe the display as the meter is turning on. It will show a checkerboard alternating pattern as seen on the screen. Make sure the pattern is regular with no missing light or dark areas in the checkerboard. After several seconds, an hourglass symbol will be displayed while the meter runs internal diagnostics to ensure everything is working properly. Once the diagnostics are complete, the meter will prompt the user to close the optics cover with the following screen. If the meter detects the optics cover is not closed within 6 seconds, the meter will beep. Every 4 seconds thereafter, the meter will beep until the meter detects the optics cover is closed. If the meter detects the optics cover is not closed within 15 seconds, the following error message will be shown and the test will be terminated. After approximately 8 seconds of closing the optics cover, a screen will display the current code number from the code chip with buttons indicating 3 testing options. Blood is for testing a blood specimen. Alternatively, ECTST will run an electronic calibrator test, and CSTST will run a control solution test to ensure the accuracy of the Mission PT Coagulation Monitoring System. Refer to the Performing a Quality Control Test section for more details. During this display time, check the code number to make sure it is correct by comparing the displayed code to the code on the strip pouch. In this example, the code number is 4. If this code is incorrect, the code chip is not the correct chip for the strip. Do not continue until the inserted code chip and the code number displayed on the meter are the same. Press the left button under Blood to continue with testing a blood specimen. During this period, the strip is warming up to its operating temperature, 40 degrees Celsius. After selecting one of the options, the display will indicate the sample testing status by either showing the warming screen or the countdown timer screen if the time to add specimen is less than 24 seconds away. When the screen counts down to 0, the system is ready for specimen application, as indicated by the following screen with a flashing arrow. The sample must be applied within 2 minutes to prevent auto shutdown. Specimen collection. Make sure the patient's hand is warm and relaxed before collecting the capillary blood specimen. Use warm water to increase blood flow if necessary. Massage the hand from the wrist up to the fingertip a few times to encourage blood flow. Clean the testing site with an alcohol swab or soapy water, and then dry the testing site thoroughly. Hold the safety lancet and carefully rotate and pull off the protective cap. Press the lancet against the puncture site firmly to lance the skin. Gently massage the surrounding area toward the puncture site to collect the required blood volume. Do not excessively squeeze the finger. Discard the lancet in an appropriate sharps container. The required specimen volume is 15 microliters, or 1 hanging drop from a capillary blood specimen. Apply the specimen directly to the specimen well. The blood drop should cover the bottom of the sample well entirely. The specimen must be applied within 15 seconds after using the lancet. Do not touch the test strip, move the meter, or add more blood during testing. For a fingertip whole blood specimen, if the test needs to be repeated, do not use the same puncture or puncture site. A new puncture must be made for each test to avoid incorrect readings due to the presence of partially clotted blood. As soon as the meter detects the specimen has been applied, it will beep and display the following screen for 8 seconds. This screen indicates that the optics cover needs to be closed. If an insufficient specimen size is applied, the meter will indicate that there is an insufficient specimen by displaying the E5 error code after 15 seconds. The meter display will change to the screen shown, indicating the test is in progress, and will count up until the test is complete. When the test is complete, the results will be displayed in International Normalized Ratio Units, INR, alone, or in International Normalized Ratio Units, INR, and prothrombin time, PT, if that format was previously chosen. The meter can be turned off by removing the used strip and pressing the power button, or waiting for the meter to automatically turn off after several minutes. Optional testing methods. A capillary tube or pipette may be used to collect blood from the fingertip and apply the specimen to the test strip. For use with the capillary transfer tube, hold the tube slightly downward and touch the tip of the capillary transfer tube to the blood specimen. Capillary action will automatically draw the specimen to the fill line and stop. Never squeeze the capillary transfer tube while sampling. Align the tip of the capillary transfer tube with the specimen application area of the strip and squeeze to apply the 15 microliters of specimen. Do not touch the strip with the capillary transfer tube or pipette. The capillary blood should be tested immediately after it is collected. Use of a capillary transfer tube or pipette helps to ensure the correct sample volume is applied. Venous blood testing for professional use only. For fresh whole venous blood specimens, insert a new strip into the meter and allow it to proceed to the specimen application icon on the display. Collect the venous blood using a butterfly collection set into a 3 milliliters syringe with no anticoagulants. Remove the syringe from the butterfly tubing and allow 4 drops to fall onto a clean gauze pad to be discarded. Apply a small hanging drop of 15 microliters from the syringe tip to the specimen application area of the test strip. The blood drop should cover the bottom of the specimen well entirely. Specimens must be run within 15 seconds after collection to obtain an accurate INR reading. Please follow proper precautions and obey all local rules when disposing of blood samples and materials. Viewing stored records. Turn on the meter. Press Next, then select Data Log and press OK to review the previous test results. The last test result will be displayed showing the test INR, date, time, and its test number. Pressing down will show the previous result, if any. Pressing up will move to the oldest test in the test result list. When finished reviewing the results, press Exit to return to the previous menu selection screen. Clearing the memory. Extreme caution should be used when clearing the memory. This is not a reversible operation. When reviewing stored readings, all readings can be deleted by momentarily pressing both the up and down buttons at the same time. This will display the Delete Log screen with Delete Log question flashing. Press OK to delete all stored data in the memory. Once all data is deleted, the memory review function will show only dashes for the stored data. Press Exit to exit without deleting the stored data and return to the previous data screen. Performing a quality control test. To ensure the accuracy of test results, the Mission PT Coagulation Monitoring System has 2 methods of quality control testing. The internal electronic calibrator independently simulates the optical signal produced by a specimen applied to a test strip and produces an INR reading, which is the same as applying a blood specimen. The inserted strip is not affected or consumed and can then be run in the normal sequence with a normal blood specimen. Liquid control test. Control solutions, level 1 and level 2, are provided as a second method to confirm the test strips and meter are working together properly and to ensure the test is being performed correctly. The control solution packages are printed with the acceptable range for the control INR results. Electronic calibrator. To initiate the electronic calibrator subsystem, insert a test strip to turn the meter on. After the checkerboard test, hourglass, and close optics cover screens are shown, the following screen will be shown. Within 10 seconds, press ECT-ST to initiate the electronic calibration test process. The next screen will allow selection of level 1, normal, or level 2 calibration values. Press either LVL1 for level 1 or LVL2 for level 2. Pressing Exit will return to the specimen testing screen. After selecting either level 1 or level 2, an hourglass figure will be displayed while the meter performs internal tests. After performing internal tests, a timer will be displayed showing the elapsed time since beginning the test. After a time appropriate for the level selected, the INR will be displayed and compared to the expected value. The result will be displayed with an icon showing the related level and that it is an electronic calibrator INR value. The EC test passes when an EC INR result is displayed without any error messages as seen. Press OK to exit the test function and run a specimen control solution or EC test. Remove the strip to return to the menu screen or press the power button to turn the meter off. Liquid control test. Check the expiration date on the control solution foil pouch. Do not use if the expiration date has passed. Tear open the foil pouch and remove the liquid control vial. Squeeze the vial firmly using the plastic clamp packaged with the control solution until the glass ampoule breaks to release the control solution. Avoid excessive squeezing or bending of the vial, which may force glass shards through the plastic vial wall. Tap the vial firmly 5 to 10 times so that the water dissolves the powder. After tapping the vial, set the vial down for later use. Remove a test strip from its pouch and insert it into the meter to turn it on. After the checkerboard test, hourglass, and close optics cover screens are shown, the following screen will be displayed. Check that the code number shown on the display is the same as the code number on the strip packaging. If the code number is correct, press CSTST to test a liquid control. After selecting CSTST, the meter will indicate the test strip is warming up to its operating temperature, 40 degrees Celsius. This is done either by showing the warming screen or the countdown timer screen if the time to add control solution is less than 24 seconds away. When the displayed countdown reaches 0, the meter will indicate that the control solution can now be applied to the test strip. Holding the prepared control solution vial with the tip down, gently shake or tap the bottom of the vial to make the solution move down to the dropper. Open the optics cover and then squeeze one large hanging drop of solution onto the test strip target area. The meter will beep when it detects that the control solution has been added. Close the optics cover when prompted by the meter. The meter will continue to display the prompt for a few seconds after the optics cover has been closed. Then, the test timer screen will be displayed to show how long the test has been processing. Interpreting the results. When the test is complete, the results screen will be displayed indicating the result is a control solution test result. If the result is within the range printed on the Mission PT Coagulation Control Solution label, the meter and test strips are performing properly. If the INR value is outside of the range printed on the control solution label, or if the meter is displaying an error message, see the control solution package insert for further instructions, or contact your local distributor for assistance. Discard the vial of control solution after use. The control solution is only good for 30 minutes after mixing the components. Maintenance. For best results, the meter should be cleaned after each day of testing. Always remember to pre-clean and disinfect the meter. This is important to prevent the potential transmitting of infectious diseases. Avoid getting liquids, dirt, blood, or control solution into the meter's power or data ports. It is recommended that the meter is stored in its carrying case after each use. The Mission PT Coagulation meter is a precision electronic instrument. Please handle it with care. When cleaning, first use Disc-Side Ultra Disinfecting Wipes to clean the entire meter surface. Wipe to remove any stains or debris. This pre-cleaning is to prepare the meter surface for a disinfection process. Next, use another fresh Disc-Side Ultra Disinfecting Wipe to wipe the entire meter surface. Make sure the meter surface is thoroughly damp. The meter surface must remain visibly wet for 1 full minute to effectively disinfect. After disinfection, please allow the meter to air dry completely before using it again. When disinfecting, avoid inserting the disc side ultra disinfecting wipe into the communication port and the power supply input port. When cleaning the optical window area, the meter may turn on when the electrodes are wet. After cleaning, the meter may be turned off, or it will turn off automatically after 2 minutes. Replacing the optics cover. Examine the underside of the optics cover. It should be clean and free of blood or other debris. If necessary, clean the underside of the optics cover using the disc side ultra disinfecting wipes as previously outlined. The meter optics cover can easily be removed if it becomes contaminated or damaged. Hold the meter in one hand. Firmly grasp the optics cover with the other hand with the thumb located on the underside of the optics cover. Place sideways pressure on the optics cover, bending one arm, attaching the optics cover to the meter, and moving the other arm with its mounting tab away from its seat. Rotate the free optics cover mounting arm up away from its seat. Once the free arm is away from its seat, the second arm can be disengaged, freeing the optics cover from the meter. Attach a new optics cover by grasping the optics cover and meter, as explained above, and locate one mounting arm tab into its seat. Rotate the optics cover down until the second mounting arm snaps into its seat. The optics cover should move freely once it is snapped into place. Once the optic cover is attached, replace the strip holder. Strip holder installation. The strip holder comes already installed on the meter. After cleaning the strip holder, it should be reinstalled on the meter. To remove the strip holder, push the strip holder away from the optics cover, sliding it off the strip holder grooves towards the bottom of the meter. If blood or debris is present, clean the strip holder using the disc side ultra disinfecting wipes as previously outlined. To install the strip holder, make sure it is aligned with the strip holder grooves as shown below. Slide the strip holder in until it snaps into place. The meter is now ready for testing. To avoid the transmission of infectious diseases between multiple patients using the same meter, be sure to replace or clean the strip holder as previously described. Meter strip specimen application area. The optical window should be clean and free of lint, blood, and other debris. Using the disc side ultra disinfecting wipes, remove the strip holder and clean the meter strip and specimen application area and the 4 metal pins, including the optical window area as previously outlined in the disinfection process section. Troubleshooting. This table displays some of the errors you might encounter and the actions you will need to take in order to solve the problem. Please refer to the user's manual for more detailed instructions. The Mission PT Coagulation Monitoring System offers accurate and precise results at your convenience. Please refer to the user's manual for detailed instructions.